Hi, I'm Chris from 3DN.
Hi, I'm Pramudie, also from 3DN.
Just a warning for our listeners, we're going to be talking about deaths in hospitals. This is a topic that some people may find distressing, so please take care while listening.
Death is a difficult topic to discuss for most people, especially when it happens on a mental health ward. But it is important to understand more about how people die so we can improve safety on wards.
So, Pramudie, you've just published research about deaths in mental health wards in New South Wales. Tell us about your research and what you found.
Well, we counted all of the deaths in New South Wales mental health wards from 2002 to 2012 and looked at what people were dying from. We found that 3/4 of deaths on these wards were from physical health problems and 1/4 were from suicide or accidents. We also found that 1 in 3 deaths could be avoided.
So what does this mean for our hospitals and the health system?
Well, I think first it shows how important it is to look after people's physical health on mental health wards, as well as their mental health. In fact, we recommend that more needs to be done to improve physical health care for people with mental illness. This can be in the community before people come onto mental health wards, but also during their stay in hospital. We need better systems to ensure that people with mental illness have the same standard of care as everybody else.
So, Pramudie, I'm not sure I quite understand exactly what you mean by avoidable deaths. Are you able to explain what that term means?
So the government lists a number of causes of death which are considered potentially avoidable in healthcare systems that are working well. For example, deaths from suicides and accidents are considered potentially avoidable. Deaths from medical conditions that are usually treatable are also considered avoidable. Our research found that 1 in 3 deaths in mental health wards met the criteria for potentially avoidable deaths.
And what else did you learn from your research?
We also found that there was no monitoring of the number or causes of deaths on mental health wards in Australia. We had to create a data set ourselves to look into this, but that data set only went up to 2012. So we have no way to tell what's been happening in the last few years. We don't know if the death rates have gone up or down or stayed the same. We are recommending that the state governments should start gathering the data so we can better understand what's happening on mental health wards. Once we know how people are dying, then we can improve care and hopefully prevent avoidable deaths.
Okay, well, thanks for telling us about your research, Pramudie.
My pleasure, Chris. I'd also like to take the opportunity to thank my co-authors, Professor Julian Troller and Dr. Priyaporn Srisubgal. Our research was published in the Journal of Psychiatric Research. See the show notes for a link. And thank you everyone for listening. If anything we have talked about has raised any concerns for you, please reach out for support by calling Lifeline on 13 11 14 or Beyond Blue on 1300 224 636.
At 3DN, we are passionate about improving the health and well-being of people with cognitive disorders.
We want to make research more accessible for everyone.
You can find out more about us by going to our website 3dn.unsw.edu.au. Check the show notes for a link. And if you enjoyed this show, why not share it with others? We hope to bring you more interviews and reports from our work. For future shows, look for us on your favourite podcast platform. Just search for 3DN Intellectual Disability and Health.